Right now, we're going to be joined by Mark Hirko from the Sharon Hospital. And as we speak to Mark Hirko this morning, the average daily rate of COVID-19 cases among people living in communities around the state of Connecticut. Well, the state of Connecticut looks pretty horrible right now with most of the state bright red, which means there's a big increase. And in our little neck of the world, North Canaan, Salisbury, and Kent, and Goshen, all are in that category, critical, as is Torrington, Litchfield, and also New Milford. So with that being said, let's welcome in Mark Hirko. Good morning, Dr. Hirko.
Good morning. Morning.
You know,
boy, that was a welcome good morning.
Yeah,
all those nice stats.
Not only when you look at that, but you look at what's happening in Columbia County, where right now they have 922 cases, 424 people right now on mandatory quarantine. In Dutchess County, over 6,500 cases. Their regional percentage positive rate now is up to almost 4%. And in Great Barrington and over in Massachusetts, it's the same thing. They've had 78 brand new COVID cases just this weekend alone. I mean, we are being hit all over here, Mark.
Yeah, we are, and it's it's I don't want to say unfortunate, but all the predictions seem to be hitting dead on. In that it cooled off a little bit. People started congregating together in closed spaces. And people are getting infected, and that's the unnerving thing is that you can actually be tested and be negative, but there's so much virus floating around, out there that literally it could be on you, or you can just pick it up immediately, and that's why it's so important to really mitigate and just say, you know what, this is the year that we stay out of large groups. It's one of those years. You have to do that.
You know, it really is astounding. I was saying earlier this morning when I was speaking with our meteorologist that back in the beginning of this pandemic, when you heard some of the predictions that by January or February, 300,000 to 400,000 Americans could be dead, and I kind of just shrugged it off and said, I can't believe that's going to happen. Well, darn, it looks like it really does look like it's going to happen.
It is, and that's the thing. It just pandemics they seem to follow a certain pattern, and we're right in the middle of this pattern, and that's the thing that we're really trying to work with the staff. We're working with our patients and even our families and say, you know what, please follow. I always get the people are joking with me because I always talk about the big three. We're wearing the mask, washing your hands, and social distancing, and that really works. I tell you, the mask is the most important thing right now because you just want to keep that the droplets and the aerosolization of you speaking, which could have virus in it, from getting out there, and it's just so frustrating. Trying, people are tired as they talk about the fatigue, and but we are now in the height of this thing.
And at Sharon Hospital, I mean, we were seeing all these incredible stories from hospitals around these states that didn't experience this past summer, or did not experience it before the summer. Have you seen an uptick yet in the hospitalization rates for Sharon Hospital yet?
Spits and starts. We're seeing a large uptick in regard to people coming in to be tested. People are really worried this time. So a lot of people coming in for testing. And we're not seeing the large numbers, knock on wood, of the people in the hospital. Now, in certain areas within our system, very high numbers in Norwalk, Danbury, Poughkeepsie with Vassar. So those are the areas that are taking the big hit. Even Putnam has been slowly starting to see a large uptick. So it's one of those things you can't really hide from this, and it just shows you how pervasive this virus is in the community at this point. High concentration.
Now, we have heard good news on the vaccine front from 2 to 3 different vaccines. One has the one thing where it needs to be so cold and stored that way. Another one, no. And then Boston, there's another one that came out today that the initial test showed it was 70% effective, and now that's up to 90%. Are you in the planning stages yet, working with Operation Warp Speed or at Sharon Hospital yet on these vaccinations?
Oh, definitely. For the last month, almost 6 weeks, as a system, we've been working with the state, with the federal government, just looking at the logistics of how we store this. Even the feds through the U.S. Army, the Department of Defense, they're supplying these very large freezers to each system just to handle the volume of vaccine. But even there, I think it's important to everyone realize that even if it comes out in a month, it's only going to be available in doses enough to really handle maybe some frontline workers and the very high-risk elderly people with multiple risk factors. It's going to take till spring or summer before we have enough vaccine out there, and the second, the 2 injections that you need before you really are, get even close to the number of people necessary that this will actually be on the downswing.
Yeah, as somebody who's as somebody who's operating a hospital, when you think of the fact that we have 320 million people in this country, that's just this country alone. And these companies that are producing this vaccine are taking a risk. They're producing the vaccine as they're making it and testing it with hope that what's happened so far with 3 of the vaccines that they're going to come through and go to get approved. But just the sheer size of how you're going to vaccinate people, will it just involve the hospital, or will it involve the hospital, doctors, and off-site areas as well?
All the above.
Okay.
I mean, that's the sticky logistics issue we're running into now. In the past, when we ran in the first wave, we had to shut down, elective procedures, and the hospitals essentially shut down, so all those workers could help out, helping us with the surge and everything else. Now we're running a full hospital. We're seeing surges of patients, and by the way, now we're expected to help with organizing and vaccinating people. Where are you going to find all the people to do all this? And so this is the trouble, and the state doesn't have the resources, and so that's the logistical problem right now. And then trying to really message it correctly, because people are wary. People are very just not. I don't know. Everybody was hoping for a vaccine. Now that it's out, people are gulping. It's like, are you sure we want to do this?
Yeah.
So you're kind of in that gray zone right now.
Yeah, and I imagine the same thing happened at the hospital, what's happening to the schools. And the schools throughout the tri-state region are having trouble as teachers come down with COVID-19, getting substitute teachers in. And I can imagine you want to try to keep everybody under your roof as healthy as possible.
Well, that's it. And, you'll hear, in ones and twos, you're going to have people that are getting infected. And some other areas in our system, we're seeing more people being infected. I just think it all, again, fits that there's so much virus out there. And it's important to know that, that no one is immune from this. So, you really have to be on the watch out at all times. And the good news is, we've had minimal spread within the hospitals, and it's mostly been community spread, but it only takes one little breach. I mean, we had an example in our system recently where a visitor came in for a week visiting their loved one, and we found out 4 days later that person had tested positive. So there were like 300 people exposed, during the week that this person came into the hospital. That's the kind of stuff that scares me, keeps me up at night. So that's why a lot of us have, shut down for visitation, just to guard against that silent spreader.
All right. Well, keep us informed, Mark. You guys are doing a great job, and obviously we'll get another update from you, and we'll follow this. And everybody will wear the mask, social distance, and wash those hands.
Sure. Enjoy the holiday, and please do it in the safety of your own homes this year, please.
All right, Mark. Happy Thanksgiving.
You too.
Take care. Mark Hirko from the Sharon Hospital this morning here on Robin Hood Radio.